Good afternoon, and thank you very much for joining us. Our United Kingdom is in the midst of the fastest growth in COVID cases that we've ever known. Previous waves of the pandemic didn't have a single day with more than 100,000 new cases reported. One day last week, we had 200,000 people test positive, and the latest figure today is another 218,000, though that includes some delayed reports. So anyone who thinks our battle with COVID is over, I'm afraid, is profoundly wrong. This is a moment for the utmost caution. But our position today differs from previous waves in two crucial respects. First, we now know that Omicron is milder than previous variants, so while hospital admissions are rising quickly, with over 15,000 COVID patients now in hospital in England alone, this is not yet thankfully translating into the same numbers needing intensive care that we saw in previous waves. Second, thanks to the fantastic national effort to get Britain boosted, we now have a substantial level of protection, higher than any of our European neighbours, with over 34 million boosters administered, including in England, reaching more than 90% of the over 70s and 86% of the over 50s. And so, together with the Plan B measures that we introduced before Christmas, we have a chance to ride out this Omicron wave without shutting down our country once again. We can keep our schools and our businesses open, and we can find a way to live with this virus. But the weeks ahead are going to be challenging, both here in the UK and across the world. There is no escaping the fact that some services will be disrupted by staff absences. But we've been working through Christmas to prepare for this wherever possible. And if we all play our part in containing the spread of this virus, the disruptions we face can be far less severe than a national lockdown, with all the devastation that would bring for the livelihoods and the life chances of our children. So, the government is acting to protect critical national services, to keep supply chains open, and fortify our NHS to withstand the pressures ahead. We've identified 100,000 critical workers in areas from food processing to transport to our border force, and from the 10th of January, we'll be rolling out lateral flow testing for all these workers, available on every working day. We'll be sending testing kits directly to these organisations and liaising with them on the logistics. We've asked qualified teachers who have left the profession to come back and help fill temporary absences, and I want to thank them and all teachers, parents and pupils for taking the precaution to test yourselves and to wear a mask in the classroom, enabling vital face-to-face education to continue. We're increasing NHS capacity by building on-site Nightingale hospitals, as well as creating 2,500 virtual beds where people can be safely treated at home. We've bought more antivirals per person than anywhere else in Europe. Those are the tablets which reduce your chances of going to hospital once you've caught COVID. We're mobilising our volunteers, the emerging territorial army of the NHS, and we're working to identify those NHS trusts which are most likely to need actual military support so that this can be prepared now. As our NHS moves to a war footing, I will be recommending to Cabinet tomorrow that we continue with Plan B, because the public have responded and changed their behaviour, changed your behaviour, buying valuable time to get boosters in arms and help the NHS to cope with the Omicron wave. So please, carry on observing those measures for now, work from home if you can, wear face coverings on public transport and in indoor places, and take a test before you go to a high-risk venue or meet those who are elderly or vulnerable. And of course, follow the relevant rules if you live in Scotland or Wales or Northern Ireland. Above all, if you haven't already done so, please get that booster. Since I launched the Get Boosted Now campaign on the 12th of December, we've delivered 10 million extra boosters across the UK. We've doubled the rate of vaccination from 450,000 doses a day to a peak of more than 900,000. We matched the NHS's previous record day and then beat it again and again, and we met our target of offering a booster to every eligible adult a whole month early. The freedoms we're able to maintain in the teeth of this Omicron wave have been made possible by the number of people getting boosted. And I want to thank again everyone who assisted in this extraordinary national effort over Christmas. Our GPs and their teams, pharmacists, everybody in our fantastic NHS, the thousands of volunteers, the ingenious initiatives of local communities like the one in Redbridge Town Hall, which vaccinated 1,700 people on Christmas Day. And every one of you who has come forward and done your bit by getting jabbed. But there are still almost 9 million people eligible who haven't had their booster. And it's absolutely heartbreaking that as many as 90% of those in intensive care with COVID have not had their booster. And over 60% of those in intensive care with COVID have not had any vaccination at all. People are dying needlessly because they haven't had their jabs and they haven't had that booster. And there are 2 million booster slots available this week alone. It's already the case that to travel to some countries, you need a booster to be considered fully vaccinated. And it's likely that within weeks, this will increasingly become the norm. So, if you haven't done it already, get yourself boosted this month. Exactly a year after the UK administered the first AstraZeneca vaccine, a British invention that has enabled 2.5 billion jabs around the world, the best way to contain this virus, help our NHS and keep our country open is to get boosted. So please, get boosted now. Thank you, and Chris, over to you for the slides.
Thank you, Prime Minister. First slide, please. This is a familiar slide, the number of people testing positive for Covid-19 in the UK, and I think everybody knows there has been a very substantial increase over the last few weeks. Next slide, please. I thought, however, it was probably sensible, because there have been significant changes in the way testing is done, better to actually just look particularly at the Office for National Statistics, ONS data, which is in the public domain, and there will be updates on this soon. And as you can see, this is, these dots represent how many people had COVID at various points in time going back to May 2020 using the same methodology. And the extraordinary increase on the far right, where we've now got to the situation where in the last week they have reported 1 in 25 people in England had COVID, more in some areas, around 2 million people in all. And the expectation is those numbers will in fact go up. Next slide, please. As several people have commented, and one of the good things that we've learned since the last time we did a press conference on this is data both from South Africa but also now all around the world, including the UK, demonstrating that there are lower rates of hospitalisation. But lower does not mean there are not hospitalisations. There are significant numbers. And just to give some kind of feel for this, at the moment there are just over 15,000 people in hospital in England. The data here are for the UK and are slightly later in time. If we went back to mid-December, when we were still with the Delta wave, the number in hospital was between 6,000 and 6,500. So a very substantial increase. People are not admitted to hospital in the NHS in winter unless they have a clear need for hospitalisation. And then to compare it to the previous waves, the wave that we had in the early part of 2020 had 18,974 people at the absolute peak. So we are relatively close to that initial peak. The January peak last year was higher. Next slide, please. If we look around the country, we can see obviously quite a variety of different patterns. London has been in advance of the rest of England and indeed other parts of the United Kingdom. The numbers, however, are still going up. There may be some slowing, but they are still going up. And I think the thing which I'd like just to add in terms of the local epidemiology in London is that it does look as if the numbers in younger adults are levelling off or falling, although we need to be quite careful because this is before New Year effects have actually taken effect. But rates in older people look as if they are still going up, and these are the people who are much more likely to be hospitalised. And the thing which is likely to reduce that, to go back to the Prime Minister's point, is the fact that people have got boosted, but that anybody who has not been boosted as eligible really should do so. I think the idea that this is a mild disease as opposed to less likely to be hospitalised, I think is easily demonstrated to be incorrect based on these data. Next slide, please. There's quite a bit of commentary, and I just wanted to put some numbers on this about whether people are primarily in hospital because of COVID or because they have it incidentally. They have another medical problem, but they have COVID on top. There are, of course, people with both. That's been true all the way through the pandemic. The majority of people who are admitted and have COVID will actually have COVID as their primary reason for admission, but obviously there are people who that is also a significant minority where that is not the case. They're in blue, and the orange data are for people who've got a primary diagnosis of COVID. Next slide, please. One thing which we have seen, and which is obviously extremely good news compared to where we were with previous waves, is that the mortality rate does not appear to have risen. The numbers have been artificially low over the last 2 or 3 days because it's a long weekend, and will be artificially high tomorrow, but we are not seeing the surge in mortality that we saw in previous waves. But there will be people, particularly people who are vulnerable for other reasons, because of age or medical conditions, who will sadly die of this. Next slide, please. Turning to the booster and the vaccination campaign, I think there are really two very important positives to highlight. The first of which is the extraordinary speed with which colleagues in the NHS and volunteers have been able to provide, and people have come forward for boosters, and the very rapid increase we've had. And additionally, and this is extremely important, people who have previously had no vaccines have come forward for their first vaccine, and people who'd previously had a first vaccine have come forward for their second. And each one of these will help provide additional protection. But we now have confidence that the booster provides around 88% overall protection against being hospitalised, and it is likely to be even greater than that for severe disease and mortality. Next slide, please. And finally, just a slide I've shown before because I just want to emphasise this, that at every age band, being vaccinated, whether it's for previous variants, and it is likely to be true for this variant, every age band, people are significantly protected by vaccination. And it is really critical, whatever age people are, that they do get vaccinated for that. We are confident this will also lead to a reduction in people having a booster lead to a reduction in people actually having COVID, and therefore a reduction in people's likelihood of passing on COVID, but the data are still being developed, so we don't have the exact numbers. But in terms of reducing hospitalizations, we are now confident that boosting provides very significant protection, and that the 1 or 2 vaccines provide some level of protection. Thank you very much indeed.
Thank you, Chris. Patrick, anything to add? Okay, well, let's go to questions from the public, and we've got a question from David in Kent. Given the government has said it will be guided by the data, what level of daily infections, hospitalizations or deaths will the government implement tougher COVID restrictions? Well, thank you, David. I think that's the key question that many people have been thinking about throughout the Omicron pandemic, and you have to think about Omicron as a disease and infection really on its own. As soon as we saw it emerge, we knew that it was likely to present a problem, and if you recall, we put in measures on, I think, December the 8th. We introduced Plan B, and I just want to say that I'm incredibly grateful to the NHS, to everybody who's working so hard in our hospitals now to deal with the pandemic. But I do think that the balance of measures that we have is the right one, and the right one for Omicron. We'll continue to monitor it clearly, but what we're saying is that you've got to stick with Plan B. You've got to follow the guidance. You've got to make sure you wear a mask in confined spaces, on public transport. You've got to make sure you get a test before you go to a venue where you're going to meet people that you don't normally meet. You've got to make sure that you, for instance, do not take unnecessary risks, particularly with elderly people. And above all, you've got to make sure that you get a vaccination, and that is the most important thing. We wanted to have a mixture of Plan B and a greatly accelerated booster program. And I just want to say, David, that it is always difficult to balance these things. There is no easy answer to a problem like Omicron. There's no easy lockdown, there's no easy restriction on people's lives or livelihoods. And the best thing I think we can do now is to continue to follow the guidance, protect our NHS in the way that we are, increase the support that we're giving to the NHS, and as you know, you heard from what I said earlier on, we're increasing the numbers of staff. Where I think we've got a record number of people working in the NHS now than at any time in the past. 5,000 more doctors, 10,000 more nurses. You'll have heard what I've said about all the volunteers. But the best way to help the NHS is for everybody to follow the guidance, follow Plan B, and above all, get boosted. And I just want to return to that earlier tragic reflection that so many people going into the NHS, so many people who are being hospitalised, sadly, David, have not been vaccinated. As I said, about 61% of those in ICU have not been vaccinated at all, and perhaps 90% have not been boosted. So the single best thing we can all do to protect the NHS is to get boosted and to get vaccinated. But we will continue to watch what happens very closely. But we think that this is the right approach to take. It's a balanced approach. It has to balance a lot of considerations. It has to balance the effect on people's lives and livelihoods of lockdowns, which are painful, which take away people's life chances, and which do a great deal of social damage to people's mental health, as well as damage to the economy. So it's a difficult balance to strike, but that is where we are. Anyway, Chris, anything to answer on? Thank you. Let's go to Amanda from Cheshire. Amanda says, I had COVID at the beginning of November and was told by Test and Trace not to take a lateral flow test for 91 days as the result may not be accurate. So how is it now reliable to use the results of these tests on days 6 and 7 to reduce the isolation period? Does the 91-day period for not using lateral flow tests no longer apply? Chris, I'm going to defer to you on this one.
Thank you, Prime Minister. The answer is that the key thing which the lateral flow is really good at is the fact that it is a pretty good guide, very good guide actually, to whether someone is at that moment infectious. And so the reason that we feel it is a useful tool to allow on day 6 and day 7, if someone is isolated because they know they've got COVID to day 5 and then they have a negative test on day 6 and a negative test on day 7, we have confidence they're much less likely to be in any way infectious to other people if they then leave isolation than if they had not done those tests. So that's the reason why adding those tests on allowed ministers to decide to move from 10 days isolation down to 7, but the last 2 you do the lateral test because they're very predictive of how infectious someone is. Obviously, if they're still positive, then they do need to stay in isolation until it goes negative. The PCR tests, which are the other way of testing, they can remain positive for a long time after someone has had an infection, including beyond the point where they are infectious. So the reason that we find the PCR is extremely good because they're very sensitive, and they're extremely good because they tell you which type of variant of COVID has got many advantages. But the lateral flows are really good at helping to determine whether someone is infectious at that point to other people.
Thank you. Let's go to Hugh Pym now from BBC News.
Thank you, Prime Minister. Would you say it's now unlikely or highly unlikely that further restrictions will be introduced in England? And a question for Sir Patrick and Sir Chris. How worried are you about what might yet happen, and what do you think might be a threshold requiring further action?
Well, Hugh, thank you very much. I just want to go back to what I was saying to David earlier on. We will monitor everything very closely. We clearly can't rule anything out, but what we're trying to do is take a balanced approach where we rely on people to implement Plan B carefully, to think of, and to behave carefully with other people, and the people are doing that. You can tell that people have really responded to this, and they're doing their absolute best in spite of the extreme transmissibility of Omicron. What we're also doing is massively accelerating the booster rollout, and it's gone incredibly fast. I think that at the moment it depends, and to be absolutely frank with you, I think it depends on the whether the virus will behave in the way that perhaps it's behaved in South Africa, whether it peaks, how quickly it blows through. But if you ask me to guess, I would say we have as I said earlier on, I would say we have a good chance of getting through the Omicron wave without the need for further restrictions, and without the need certainly for a lockdown. I think that the reason we're in that position, unlike many other countries in the world, certainly unlike many other countries in Europe, is that we just have such a high level now of booster protection. But that is no reason for everybody not to get more.
So in terms of the what do we think going forward? Well, we know two things well, and that is this is very transmissible, and we have extraordinarily high levels of infection at the moment, as indeed do many other countries. So large numbers of people have the disease. We also know that this is not as severe. There's a reduced chance of hospitalisation. That's now clear. It's a mixture of the virus itself perhaps being less severe and the immunity that's in the population, but the chance is down by somewhere between 50 and 70% in terms of getting into hospitalisation. So those two things together mean we've got a chance of more people going into hospital because of the degree of infection, and some lesser chance because of the mildness. What we don't know, and these are two things that we don't know that are key, we don't know exactly when the peak's going to occur or how big the peak's going to be. That's one thing that will determine how much disease comes on in terms of hospitalisation. And the second really important thing is that this has largely been an infection amongst younger people up until now, and it's moving up the age range now. And as it moves up the age range, you would expect to see more hospitalisations, and we don't know for sure how that's going to manifest and what degree of disease. So I think with the degree of infection we've got, we are going to see more hospitalisations for sure. 15,000 per day at the moment. That I expect to increase, and that of course will be associated with increased pressure and ultimately, of course, with some fatalities as well. And I think what we now need to look for is when this peaks and starts to come down.
Can I just add to that? I mean, I think that from a health service point of view, I kind of divided into some different sort of groups. I don't think we think that the ICU pressure is going to be what it was in previous waves, but there is very substantial pressure on the emergency service part, ambulances, A&Es, and my colleagues in the NHS who are in the emergency side are having an extremely difficult time because they've got a simultaneous wave of people coming in with COVID on top of the usual winter pressures, and you've got a wave of people who are off sick because they have got COVID, or indeed for other reasons, but COVID is very substantially contributing to that. As Patrick said, we would expect the peak in younger people to come before the peak in older people, so it may well be that the workforce problems start to decrease before we start to see any decrease in the number of people coming into hospital. In fact, they could still very well still be going up for some time. So I think I would just dissociate those two. And of course, workforce problems also apply to things like people's transport, all the critical services and so on. So I think they will end up in two slightly different places because of this age effect. In terms of threshold, for the NHS, it's less that there is a single threshold and more that little by little, routine and then urgent but not emergency, and then so on, things are rolled back. So it's a little by little the NHS has to retreat to the most urgent things over time. And obviously we hope that that we can still keep urgent but non-emergency services running everywhere, but in every winter there's pressures. In every winter there are times when hospitals have some difficulties. What COVID of course will do is make that considerably more difficult. So it'll be patchy in different areas of the country, it'll be patchy at different points along the epidemic, and it won't reach a threshold, but there will certainly be some hospitals, some areas of the country which will come under very substantial pressure over the next couple of weeks.
And again, just to build on something that we said at the outset, when you could see how transmissible Omicron was, there are three things really that cause the big worry. Hospitalisations as a key thing to keep an eye on, staff absences as a second, and that things like the testing infrastructure become incredibly stretched as you get to these very high numbers and therefore become difficult to operationalise.
Thanks very much, Hugh. Emily Morgan of ITV.
Thank you. Prime Minister, you say that we have a chance to ride this wave out without having extra restrictions, but isn't the cost of that patient care? Are you absolutely confident that all patients will be cared for safely in the coming weeks?
Thanks, Emily. Well, of course, I want to thank the NHS for what they're doing. They're doing an amazing job. And yes, and as I've said before, I know that they are now, as Chris and Patrick have also said, the NHS is now under a lot of pressure. But I'm also confident that we can get through it. And what we're doing is supporting the NHS in any way that we can, and we will continue to do that. But what we need to do is to remember a few things. First of all, lockdowns, further restrictions are not cost-free. They're not cost-free for lives, for livelihoods, for life chances, closing schools. These are very, very difficult things to do and have long-term consequences. And as everybody can see, although Omicron does cause lots of hospitalizations, it does result in, at the moment, pretty clearly result in fewer people in ICU and thankfully, at the moment, certainly less mortality than we've seen from other variants. So that's why we think the balanced approach that we're taking is the right one, and to keep going with Plan B plus this acceleration of the booster campaign, and that's the balance that we're striking. Thanks, Emily. Ben Kentish, LBC.
Thank you, Prime Minister. Two questions to you, if I may. Firstly, your winter plan for tackling COVID says the government is committed to doing whatever it takes to prevent the NHS from being overwhelmed. But as beds fill up and 1 in 10 staff are off sick, operations are cancelled and more trusts declare critical incidents, isn't the NHS already overwhelmed and you're not doing very much at all to stop it? And secondly, if I could, on the issue of staff absences that you've touched on, at LBC, we've been hearing about lots of NHS workers who say that even now they haven't been given the FFP3 grade medical masks to protect them from COVID. Others say they can't access lateral flow tests to prevent them having to isolate. What would your response to them be? And if I could just ask Professor Whitty, Sir Chris, very quickly, how frustrated are you as a medic, Sir Chris, about the number of beds that are being taken up by people who have rejected the offer of a vaccine? Thank you.
Thanks very much, Ben. Well, look, so on your point about FFP3 masks and lateral flow tests. I will take that up. But we're doing everything we can to make sure that the NHS is supplied with all the PPE that they need. And generally speaking, there's been a heroic effort to get people what they are. I'll perhaps ask Chris to comment on that in a minute. But on your basic point, Ben, about is the NHS overwhelmed? Well, look, I mean, the numbers are high. The numbers of people going into hospital right now are high. That's clear. And there are 15,000 currently in COVID patients in the NHS in England. Those, as you'll have heard from Chris, and not all of those are there wholly and entirely because of COVID. Some of them, perhaps 25-30%, have contracted nosocomial infections. So you've got to think about that factor. You've also got to recognise that this is a milder variant in the sense that it keeps people in hospital perhaps for a shorter period. That's not in any way to minimise the pressure on the NHS now. It's not where it was, clearly it's not where it was in the January peak yet. The best way that I think we can prevent that is to continue with the strategy that we've set out, and that is everybody being sensible, following the guidance, implementing Plan B, but also getting boosted. And to your point, Ben, about people who haven't been vaccinated. I mean, how absolutely crazy it is. Absolutely crazy that there are 2 million slots this week for people to get vaccinated, and yet the majority of people in ICU for COVID are not vaccinated, 61%, and the overwhelming majority of those in ICU have not been boosted. I mean, really, this is it's sad, but it's also a huge opportunity for us to try to correct it. And I just say to people, the boosters, the vaccines really are the way forward.
The Prime Minister asked me to comment quickly on FFP3. I mean, I think there are two separate questions, really. There's a question about a technical question for which there is a debate about what are the situations where it's useful and which are the situations where it isn't. Nobody wishes to wear an FFP3 if they don't need it. They're not much fun to work in. But on the other hand, they must have them when they are in the right place, and that's a technical discussion. And then there were several different views on it. And then there's a separate question of if people do need it, is it available? And in that situation, we are far better placed than we were last year. But of course, if anyone hears of shortages, people need to escalate that, because it is critical that people do have the kit that's needed when they get to the point where they need it. On the one you asked me about, would I get frustrated with the word you think? I would say my experience of having talked to people in that situation is I'm rather saddened, because the great majority of them, they're not anti-vaxxers in the ordinary sense with sort of really weird ideas, but essentially there are three questions people want to know an answer to. They want to know, is this disease important enough to be vaccinated against? And I can say very clearly, the fact they're in hospital means pretty clearly this is a serious disease. This is still a serious disease. The second question is, do the vaccines work? Well, we're very confident the vaccines work. As I say, 88% protection is our current estimate, may change a bit, in terms of reducing the chance of you going to hospital, even more, almost certainly, going into intensive care, as the Prime Minister said. And then the third thing, and this is where the misinformation there is around on the internet, a lot of it deliberately placed, is a problem, is they worry about side effects, and that's understandable. And it is the job of health professionals not to get frustrated by that, but simply to say, look, let's go to all of your questions properly and systematically and say, which ones are fair and which ones, and as in many cases, are really completely untrue, but have been put into the public domain, often deliberately to scare people. So insofar as I'm frustrated, it's simply people deliberately trying to scare fellow citizens away from getting something which is going to be potentially life-saving for them, certainly stop them getting a hospital admission and protect people around them. The final thing people, of course, then want is convenience. And that's what the booster programme has allowed, is a massive expansion of our capacity. And if people have not yet had a vaccine at all, now is a very good time to get it. There's a lot of capacity, and we really would like to use it, whether it's first, second or third doses that people are needing.
Thank you, Ben. Rowena Mason, Guardian.
To the Prime Minister, what is your definition of the NHS becoming overwhelmed? And is this still your guiding principle that you would bring in restrictions if the NHS is at that point? Because a lot of people working in the health service feel that that's been reached already. And to the Chief Scientific Officer and Chief Medical Officer, do you agree with Andrew Pollard of the JCVI that we can't keep on getting booster jabs every 6 months, that it's unsustainable for that to just keep happening forevermore?
Thank you very much, Rowena. Well, look, I think the NHS is under huge pressure. I won't provide a definition of what being overwhelmed would constitute, because I think that different trusts in different places at different moments will feel at least temporarily overwhelmed. And anybody who, in hospitals at the moment are sending out signals, as you know, Rowena, saying that they're feeling the pressure hugely. And I understand that, and I thank them for the work that they're doing. It's absolutely fantastic. There are not as many COVID patients in the NHS now as there were in the January peak, not by a long way, but sadly the numbers are likely to grow. There are the various mitigations that I've already mentioned, the relative mildness and so forth, the shortness of stay, and so on, the fact that people don't go into ICU nearly so much, and so on, as Chris and Patrick have already said. But in the end, it's people in the hospital. It's the pressure on A&Es. It's the ambulances arriving. That's creating that huge sense of pressure, and I totally understand that. I've just got to say to people that, as I said yesterday, there will be a difficult period for our wonderful NHS for the next few weeks because of Omicron. I just think that we have to get through it as best as we possibly can. We will give the NHS all the support that we can. But in the meantime, the thing we've got to do as responsible members of the public is follow the guidance, try to stop transmission as much as we can, and get boosted. And, I can see the limit in the value of people like me, endlessly saying from our pulpits, come on and get vaccinated. We do need everybody to join this movement. There are many evangelists for this now, and we need everybody to build the movement. There is a big opportunity to turn this around. 9 million people still to get a vaccine. Now's the time.
In terms of the vaccine question, what's the good news is that as you get vaccinated more, the immune system broadens its response so that it covers more variants. So the immune system tends to get broader as you get more exposed to infection or you get vaccinated. And there are different parts of the immune system, some of which have a very long-lasting memory of what you've seen before, and therefore will provide some durability. I think Andrew Pollard's right. It would be a situation that isn't tenable to say everyone's going to need to be having another vaccine every 3 or 6 months. That's not the long-term view of where this goes to. There will be some people who may require an additional dose, but longer term, I would think that as this becomes a disease which is endemic, in other words, we have it circulating, it comes back every year, it will be something like an annual vaccine like flu or something of that order, which this moves to. Exactly which vaccine that is, we don't know yet. That's going to be something that people will work on over the next months and in years to come, as well as we think about long-term vaccine strategies. So I don't see this as being something that you end up having a vaccine from as frequently as we do now. We need that because it's the very early stages of this disease, and we needed to get boosted for this variant at this moment. So I think there'll be a change over time, and this will settle into a much more routine type of vaccine program as we have for other infectious diseases.
Thank you, Rowena. Harry Cole, the Sun.
Thank you, Prime Minister. You said that it will become increasingly normal for 3 jabs to be required on vaccine certification. When are you planning on making that the rule in Britain? And wouldn't it be totally unfair, given that millions of people who've suffered Omicron over this Christmas period have to wait for 28 days to get their jab? So can you rule that out until February? And Prime Minister, if I may, can I draw your attention to an article you wrote for The Sun on the 31st of May, 2016, where you said that if we leave the EU, energy bills will be lower for everyone. EU rules mean we cannot take VAT off those bills, and the least wealthy are particularly hard. You went on to directly promise when we vote leave, we will be able to scrap this unfair and damaging tax. Yet as Prime Minister, you're refusing calls to cut VAT or scrap VAT on energy bills. What's changed, or were you misleading voters?
Not at all. But on your point about certification and the booster, look, I mean, I understand what you're saying, Harry, and we certainly don't want to do anything that's unfair to anybody. But clearly, there will be countries that are going to start saying, for travel purposes, for instance, that getting a booster is their condition for allowing Brits to arrive there. So it will be very much to people's advantage. Let me put it that way. It will be very much to people's advantage to get your booster. And when we propose to change the definition of vaccine certification, we'll be sure to give people plenty of time and plenty of opportunity. And I take your point about the unfairness for people who've had Omicron over Christmas. That is a very reasonable point. But on your point about VAT on energy bills, I mean, I think it is slightly paradoxical that this is now being campaigned for by people who actually wanted to remain in the EU and still do, when it would be impossible to deliver within the EU. We will continue to listen to businesses and consumers about how to abate the costs of energy, Harry. And in the meantime, there are all sorts of things that we can do to help people. And I appreciate the difficulties that people are facing because of the increase in gas prices. But you know, we've got the warm home discount, £140 rebate on energy bills, winter fuel payments that cover 11.4 million pensioners, and the cold weather payments and so on, as well as a £500 million contribution through local government to help those who need it most. Harry, I'm not ruling out further measures, and you are quite right to draw attention, as I did in that piece, to the potential that is contained in the freedom to regulate our own VAT. Whether the argument, as you know, is that it's a bit of a blunt instrument, and the difficulty is that you end up also cutting fuel bills for a lot of people who perhaps don't need the support in quite the direct way that we need to give it. We need to help people who are in fuel poverty the most. But as I say, we will listen to consumers and to businesses as we go forward, and we are certainly and Rishi Sunak is very, very mindful of the increase in energy prices and the effect of the increase in energy prices on people up and down this country, and we are going to do what we can to help. Chris, anything you want to say about energy prices? Okay, right. Good. Who is next? We got one more to go. It's Nick Cecil of The Standard.
Thank you. First, to the Prime Minister and to Sir Chris, given the COVID situation in London and the fact that so many central London businesses have been so hard hit by the Plan B measures and Omicron concerns, what is your message to people about returning to use pubs, restaurants and clubs in central London? To Sir Patrick, do you think the Omicron wave has now peaked in London? And if so, given the evidence from South Africa, how quickly could cases fall? And finally, Prime Minister, as a former Mayor of London, will you push for a long-term sustainable funding deal for Transport for London to help the city to recover?
Chris, who's doing COVID in London? Chris.
Well, I think we both are in different ways. Do you mind to go first?
Yeah, you go.
In terms of a message, I'm going to answer that rather indirectly, and that is that the reason that so until we've actually had the peak in the most vulnerable, that is the people who are most likely to go to hospital, any measures that are taken that help pull the peak down, slow it down, are beneficial in terms of reducing the height of the wave, and that is having an effect on businesses, on homes, and above all on the NHS and people's healths. So people have been incredibly responsive, and I think we should all be incredibly grateful for the way people have responded to the fact that there is a need. Unfortunately, no one would want it, but there is a need for people to be very careful still, as the Prime Minister said, to work from home, as the Prime Minister said, to use masks, but also to prioritise, as we've talked about several times before. The response to that is one of the reasons why the rates have not gone up even faster and even further. Obviously, hopefully, there will come a point in the not too distant future when the rates are coming down, and that's the point at which I think these kind of things are much easier to address. But before we've reached the peak in the most vulnerable people, I think we need to keep the messaging really, really steady on this.
Shall I build on that for the second question?
Go on.
So in terms of has it reached a peak in London, the answer is there is no evidence it's clearly reached a peak. And whilst it may be the case that in the younger age groups, this is flattening off or possibly even beginning to come down, not least because they had such a big wave of infection, that is not true in the older age groups. It's still going up in the older age groups. So I think it would be very wrong, and Chris has alluded to this, to suggest that there's a peak which means it's all over in London. It may well be flattening in some of the younger age groups, but it's in the older age groups where we have the biggest risk of this turning into hospitalisation and severe complications, and that is definitely not the case yet. So we need to keep watching. We don't know when the peak's going to occur or how big it's going to be, but we need to see it happen in all the age groups, not just call it when one age group looks as though it's turning. And then just to build on the other point about Plan B, it wasn't Plan B alone that was important to bring it down. It was the behaviour that everyone took up really well in the run-up to Christmas and over the holiday period to change their behaviours, to try and reduce social contacts, as initially suggested by Jenny Harris and Chris before Christmas. That's a really important part of this. And until we've got to the older age groups coming down, it's important that we retain that caution.
Yeah, and Nick, on your point about Transport for London, never forget that it was left with a very considerable sum of money by the outgoing, the previous mayor who left the coffers full, and not least the Crossrail and everything else. However, we are where we are, and it is vital that our great capital cities got to be able to move around. Of course, ridership has been down because of the pandemic, but I know you and I and the current mayor, Nick, devoutly hope that ridership will come back, and one day it will come back without masks on, we hope, and our capital city will be buzzing again. And so it's vital that London is properly provided for, but what it also requires is a mayor who's going to institute a sensible and pragmatic fares policy, and not the retrograde one that we saw the early stage of the current mayor's term. So that's what we're looking to achieve. Okay, on that, unless Chris Patrick want to say anything about fares on London Transport, I think we will conclude it there. Thank you, everybody. Thank you.